Today, I'm thrilled to welcome Shobhana Nair, a certified nutritionist and diabetes counselor with over 30 years of experience leading responsible wellness. She has helped thousands in reclaiming their health, managing diabetes, hormonal imbalance, PCOS, and much, much more. If you want to build a wellness practice that truly transforms lives with emotional clarity and the precision impact, this episode is for you. Let's dive in and welcome Shobhana to the show. Welcome, Shobhana.
Thank you, Geeta, and such nice words coming from you.
So, Shobhana, just give us a little introduction about how you started, where you stand today.
So it's a story back 30 years. I started my career from Madhya Pradesh. My guide was Dr. H.S. Patel, renowned endocrinologist over there, and I started my career from there. So that was a time when you can say that I was a rookie in this field. But yes, I started my career from such a well-known personality that he's still practicing in Jabalpur, Madhya Pradesh. And I did my degree over there, my research work over there under him. And yes, I'm here. In between, I was there in Gwalior, Jaipur. Then I came back to Madhya Pradesh. Then I went to Rajasthan. So this was a kind of transferable conditions, which happens in our family. You know it. So this happened, and then it was a boon for me because I could give my service to all those people over, many places. And yes, now I'm in Kochi, Kerala. Before that, I was in Mumbai for 10 to 12 years. So, yes, this is my experience throughout. Yeah.
Okay, Shobna. As you said, you have an experience of 30 plus years in clinical nutrition. How has your approach evolved to address the emotional, psychological aspect of chronic diseases like diabetes in your clients?
So, over the last 30 years, my work in clinical nutrition has shown me that talking alone about food doesn't work. In the beginning, it was like when I was a new person in this field, we always used to have those, calculations like you are calculating nutrients, you are calculating calories, you are calculating all the things. And that was a theoretical approach. But over a period of time, when you counsel people, it is very important to indulge with their emotional connection. So, yeah, so that was the beginning where I started with counseling, proper counseling with conditions like diabetes and PCOS. The struggle is not just about the metabolic disorder, what they are facing with. It is with the stress, the lifestyle, or the habit what they have made throughout, over a period of time, what they have made the habit. So these all come under that. And then when you counsel them, you'll come to know that yes, they are having, it's not just a lab report what you're seeing, but behind that you have got a lot of stories to hear. So the first what the approach what integrates is mindful eating practices, what has to be, because they have got so much of connection with the food, relationship with the food, that has to be first catered. Mindful eating practices has to be delivered. Then stressful management techniques. So all the stress management techniques, for example, if the person is having all those conditions, their professional life, their personal life, and with that, how they can manage the stress. Because once they, for just for diabetes, when I say, once they get that condition that yeah, I am a diabetic right now, so this is going to be a long term condition. So what has to be done for that? So stressful management with the conditions what they are having as a physical condition, they both has to be managed. So stressful management techniques has to be delivered. Then behavioral strategies, how they have this behavior, like they are very much indulged with their habit of eating different things. So now they have a fear in their mind that now everything has to be restricted. all the things, the realistic changes comes, everything will be restricted, and then their life will be upside down. So that's where you need to understand that, yes, the shift, what it has to be bought, like from a normal condition, what they used to think that it is a normal thing, but from there, how it has to be shifted, this all things comes. And as a responsible wellness group, the team what we have, so it's kind of a collaborative partnership, with the patient, the team member, me, and junior dietitians are there, then therapists are there. So all this plays a great role. And yes, they are very happy. Those patients, those who come to us, they are very happy because we cater in such a way that everything is taken care, with the emotional balance and the physical being is being taken care of. Yeah.
So I love the way you said it, Shobhana. It's not just the theoretical counseling that is about the number of nutrients, the amount of quantity that you need to take, but also the emotional and mental health of the patient needs to be addressed too. Saying that, how do you integrate emotional and psychological intelligence into the patients? And when dealing with them, how do you actually bring out lasting change using these?
The first thing of how it comes is emotional well-being, which is kind of very close to heart, managing the complex conditions. So emotional well-being, if for example, there are people from childhood, they have come into many they have gone through many conditions. For example, a person who is obese, just a small example, I know those people who is obese from childhood, might be they are healthy, there is no other situations or conditions, physical conditions, everything is normal, but then that person from childhood has heard about many things, the taunts and the social people, or the social stigma is there that, yeah, you are obese person. So that emotional conditions, deep down, the person is so much sabotaged with all those conditions, unresolved emotions, we can say. So what happens is that it is there throughout, although that person is very normal, very healthy, has given birth to children, they are in good position, everything is normal, but still when I talk to them, they say, from the childhood I was hearing this about my health, although I am such okay person, and there is nothing happening inside my body, or but then yes, I have heard much about me. So that is one of the emotional condition what they are dealing with. Second is the physical condition. Even if you are into a normal diet plan, or a good diet plan, or you are eating well, you are eating right, still you have got that stress. If some stress is there, that healthy eating is not working on you, because there the cortisol levels are on a higher side when you are stressed, and eating healthy and eating right is also not working for you. So we need to create a safe or non-judgmental space, when you deal with the people who have got these type of conditions, and when there is a stress and anxiety level which is on a higher side. So you need to create a space, safe space, and a non-judgmental space. That's the reason why they are coming to you, to have a good, what they want in their life, to be peaceful, to have a stress free life. So we need to have to give them that space, and then with that we need to tell them about mindful eating, exercise, and whatever is needed for their physical conditions. So these two things has to be there and has to be balanced. Yeah.
Absolutely. As you said, I really relate with you when you said that childhood traumas and the trauma that you're carrying within from the time whenever it might have started in your life, all those trauma also takes a toll on your health. And it is not just the chemical or the body wise thing that is affecting your health, because your psychological and your emotional health is affected, your physical health definitely gets affected. I love the way when you put it that it is the holistic development of both health parameters like mental, emotional, and physical that should be included. In saying that, in the holistic diabetes management that you do, what key treatment goals are there, type 2 diabetes in particular? And truly tell me, is it really reversible or just manageable beyond medications?
Reversible, I should take that point first. Type 2 diabetes is a diabetes when when you reach certain age, after 35, 40, when you reach at that age and you are getting your blood sugar on a higher side. And when it is seen, when everything is being the test and everything is done, we come to know that type 2 diabetes is because of one of the reason that the person is having insulin resistance. The person is having enough insulin in the body and it is not working. It is not in an active stage. So there's an insulin resistance condition. Now, insulin is a growth hormone. When it is there too much in the body, you can put it in a way that when it is there too much in the body, you are gaining weight. Okay, so that weight factor is also there. So obesity is also there. The obesity, kind of obesity, visceral obesity, that's the center part of your body which increases the tummy part, and that's called visceral obesity. So all these things is connected with type 2 diabetes. Now, for the reversal condition, what we can say is, for example, a person goes to the doctor and the doctor goes with all the tests. And when you get the report, it is, yeah, your HbA1c, glycosylated hemoglobin, is on a higher side, your blood sugar is on a higher side. Doctor will ask the person that you need to take care of your diet, you need to take care of your exercise, and come back to me after 2 months. If everything goes on well, the person might be in a reversal condition. So yes, so this that particular time period, that is working on him. But when what it happens is, once the person is going to the doctor and when it is seen that he has landed up into a lot of complications. So it might be the first time he's visiting with the diabetes, but he has landed up with a lot of complications. And there you cannot reverse things. So you cannot say it is reversible. It can be a remission for certain period of time, that you're okay with this kind of diet and exercise, but then you need to be watchful that you are not going beyond those levels. So if you go beyond those levels, you are certainly ending up into becoming a diabetic. And remission part might be there, yes, for a longer period of time. You're not taking medicine or something like that. No regime or no treatment is there. This is what about type 2 diabetes. Reversal, you cannot say that once the things are settled as diabetic and then you are going back in a reversal mode. So no, it is not like that. It can be a remission, but once the complication develops, or we can see that no, this will not help him or her. So we cannot say that it goes with reversal. So there are
Okay.
certain regime that they have to follow. Remission part can be there, but then they have to be very watchful. So that is what about reversal of diabetes is. Yes.
Okay. You have experience with so many clients. In your experience, what role does emotional well being plays in managing conditions like diabetes, obesity, infertility, and how do you address it and how do you bring it into practice with your clients?
So, as I said, that it's kind of a collaborative partnership. When I have seen a lot of patients, whether it is about PCOS, PCOD, infertility, diabetes, everything is connected with how you are setting a goal for each and every person. Every person has got individual, personalized form conditions. Like, for example, if a person is two people are there, both are type 2 diabetic, or both are having PCOS, it is not, the goal setting is not same, even though they have got same disease. So goal
Yes.
settings has to be important with the patient. That is where I take care of that. How with the patient, it's kind of a teamwork. The patient is coming to us with all those conditions. We are there with the person for 3 months, maybe for 1 month, maybe for 2 months. But then it doesn't mean that once a counseling is done, the person is going to, follow all those things. It is a continuous education kind of thing, continuous monitoring kind of thing. Every day, our team track with the patient that how it is happening. The patient connects with us every day. After a week, we go for again next counseling, and then these kind of, you can just transform everything every week. All those things are considered very seriously. And how this happens is like, if a person is having, for example, diabetes or PCOS, how the goal set has to be done is like, if the patient is saying ki, I went to doctor, I have got infertility. Doctor has said that I have got infertility, I have got PCOS, and I have my some of the blood reports which is on a higher side, say dyslipidemia. But and doctor has asked me to reduce weight. But then, what is her aim? Her aim is not that is the next level, like the infertility, diabetes, and all is a next level. She wants or he wants to have a right way of living lifestyle. She want to change her lifestyle because she is into a condition where she has got a lot of advices from many people that you need to reduce weight. Oh, you are infertile, so you need to eat this. You are diabetic, you just stop eating rice. So all these things are there, and she has got her own routine with all the works throughout her day. She's busy with the work, but then her goal is to first have the lifestyle proper. The proper lifestyle is her goal. So we need to talk, we need to listen. That is active listening, emotional, to be into a emotional well-being. First thing is to active listening. So she might be telling, okay, my conditions are this, but my goal is to have a good lifestyle first. So we need to set that first, that her lifestyle has been set first, and you will get the result in between that. Yeah, after having this kind of routine, everything is solved. I'm losing weight, then my periods has got regular, and many of them, they say, I have conceived. So all these things can come, but then the goal setting has to be there first with the person, and then we can cater, like, after that we can tell them that this has to be in your routine because you have got this. So that comes next. So first is the goal setting. It's kind of, as I said, that it's kind of a collaborative partnership with the patient and the team. So that is how it is. And then comes your teaching of mindful eating, or as I said, creating a safe or non-judgmental space. All these things comes after that.
I liked it when you said it is first about setting that person in the right tone, because she might be carrying all that kind of knowledge that everybody might have gathered and given to her, and something that she might have taken up by herself, reading here and there. So, all the unlearning has to be done first to relearn the correct things. You set the tone first, and then
Correct.
you go into the procedure for fixing up our goal setting, our goals, and then working on it. But there is something very important right now, which is very viral on YouTube. That is called therapeutic wellness or therapeutic diets. What is the difference between that and the standard diet that already is there in?
As we know that from the beginning we have got goals set at home from the childhood, that we have to be disciplined with the timing of food, can circadian rhythm of the body, which plays a role. So things are set at home itself, that you need to get up at this time, you need to have your breakfast, lunch, dinner, all these things are there. So when you get into that routine, that is your wherever you're finding that, yeah, this diet is okay for me. So for that, healthy living style, you might get information from, or you might be approaching a certified nutritionist for the healthy living diet style. So it is being given to you, so you are following the same pattern, and you are just okay with that. At a certain point you might get into that, you might be going for test, and then you will come to know that you have got low hemoglobin, or you have got disturbed lipid profile, or your blood sugar might be on a little high side because you were taking some medicine. It might be some conditions, and there it is seen that you are into a condition where you have got A, B, C, D, all these kind of problems. So now here the general diet will not work, or the healthy diet will not work. That, for example, you are a anemic person, your hemoglobin is on a lower side. So now the thing is that the diet has to be according to the condition. So we need to explain the person that yes, you have got this situation, this condition. We need to have certain things in everyday life. It's not a medicine that you have got a 5 days course and your cough and cold is gone. It's not a medicine. It's a natural process what you are going to take, and it's coming into your habitual lifestyle. So that you need to understand that when you are taking certain kind of food which is going to eradicate all those conditions, you have to be very vigilant, and you need to have it every day until unless your nutritionist is telling that okay, now your reports are okay, you can slow down with that. So that is the difference between a general normal standard diet and a therapeutic diet. So it's kind of a medical nutritional therapy what we give for certain conditions. I cannot ask a person that you can have today this. Their varieties doesn't come over there. So there are certain things you need to eat every day. That means, yeah, to get better result, you need to have those things every day. So that is the difference between therapeutic nutrition, which caters your conditions or the situation where you are. Yeah.
So you mean to say that whatever you have in your daily routine diet is your standard diet, and when you are in some medical condition, and some food has to be included not as part of medicine but as part of recovery for you, and it might go on for a long period of time. It is not a choice, but you have to take it to recover. So that becomes a therapeutic diet, right?
Yes.
So, Shobhana, your wellness program is an amalgamation of natural nutrition and that you are blending traditional wisdom along with modern knowledge. So, how does it work?
So traditional nutrition means you mean to say about Ayurvedic nutrition and the modern nutrition, right? So Ayurveda has always taught us that food is a medicine, and everything a person is because of what he eats. It is always been taught from a period of Ayurveda. Where our country, it's like having Charak and Shushruji as a legend who started the medicine. In fact, you can say it has always taught us also about the circadian rhythm of the body, about how to discipline our body while the whole day dincharya of our has to be set, what to eat, when to eat. So this all thing was from the beginning when we knew Ayurveda, and we practice it. Still we practice it with the modern medicine. For example, Ayurveda has given us all the knowledge about the day-to-day ingredients what we are eating right now, as a for example, turmeric or fenugreek seeds. All these are, it's there in our life. But how much is too much? So that comes the modern medicine. I'll explain you with the example that we know that haldi or turmeric is good for the body. It's antiseptic and it helps a lot of things in the body. But that doesn't mean that it has got, you can have it in any amount. So there is a restriction. So there are certain researches which is being done that, okay, whatever you're eating throughout the day for your preparation of meal, this is just an example. Okay. So for the preparation of meal, whatever you're doing, you are adding this turmeric, as in a pinch of turmeric or half a teaspoon of turmeric, which is sufficient for the whole family. But then you are having that as a, right now we can see that people, they just have 2 teaspoon of turmeric in water in the morning or somewhere, like just to think that this can help them in for some situations, like they have got some infection in the body, so they don't need medicine, and they can have this thing and it can be cured. So it is not like that. So Ayurveda, they have given the knowledge that yes, these all are necessary for the body, and they have given the measurement also. Okay, you can have this much throughout the day. But then modern medicine has given us researchers and evidence-based think that yes, these all are necessary, but what is the amount you need to set? You need to figure out that this is yes, this is the your traditional food, and this is how it works because it is gone through all the research work, so you know how it will work. So this is what the difference between the modern kind of nutrition and the Ayurvedic nutrition. So yes, we have got a lot of knowledge about Ayurvedic nutrition. Everyone, they have some or the other way, like you have to eat fenugreek, which is good to reduce your blood sugar. Okay, fenugreek can reduce. It is seen that yes, there are certain effects, but how much of fenugreek is going to reduce how much of blood sugar? That is what the question is. So modern science have shown us that you need to have it in lot of amount to just get 5% reduction of sugar. So every time it doesn't work. So this is where you need to, an Ayurvedic diet or a living style of Ayurveda, you need to imbibe that all these kind of things from the child. We are brought up in such a society that we have got all these things present in our day-to-day food. If we add all these ingredients in our food, which is sufficient. So there is a line between that modern medicine and the traditional medicine, how a traditional diet and modern diet, how it works. So that is the difference. And traditional practices, yes, I do ask people to have that traditional practices. For example, when you wake up in the morning, you need to have water. But how much of water is important? Just a small, sip or two sip or three sip is sufficient. So you don't need to go for a whole bottle of water, 2 liters of water, which is not going to give you any extra benefit. So yes, so traditional practices and the modern practices, which has to be evidence-based practices. So that is where it will give you benefit. Yeah.
So it is a fine line between how much is too much. You have to restrict
Yes.
yourself going overboard. That's a good one.
Correct.
Shobhana, when people come to you for diabetes or some kind of lifestyle diseases, and they actually want to work on themselves, what are the main mental and emotional barriers that they bring along with them and you have to work through?
You can see with all these conditions already they are into such conditions where they are into shock that they have got certain conditions like diabetes or infertility. So all these conditions, but then yes, the first thing what they have in their mind is fear of failure. By doing all these things, will they get any result? I'm spending my whole day in, planning the diet, and uh, doctor has asked me to eat this, and mom has asked me to eat this. So that fear of failure is always there with them. That will I get that result when I end up counseling sessions and all, or they have got their own mindset that I am into this kind of habit. Now I am into a certain kind of regime. I have to change everything now. It will be totally different. There will be restrictions for many things which I cannot do. So all these kind of fears are there. And when I start counseling with them. It's like, as I said, it's a teamwork. So many things are there. Counseling comes first, and it's very important that you listen to them and then counsel. As I said, that goal setting has to be there. But we can understand during this period of time that a person, every time he or she can say that kya ho sakta hai kya ma'am, or whether it will work or not. Every time I remember one patient asking me every counseling, will I get pregnant next week or next month, like that. So that kind of fear is there. So we need to overcome that kind of fear, and that's a fear of failure is the first thing what we can see with the patients. Many of them, and many of them they are into, yeah, very very strong that yeah, I will be doing, and no matter whether I'm getting a result or not, but yes, I'll be following it. So this kind of things are there. emotionally they are into many, and yes, these hormonal changes are there when they are coming to us. They are into a condition where the hormonal changes are there, hormonal imbalance is there. So these kind of things are there. Guilt, feeling of guilt is there when they start with the counseling. And then when I say that I track them every day, they have got this condition, they start ghosting. I mean, they don't turn up telling their problems, whatever they are facing throughout. So now the next week is the next session. And they have that feeling, okay, how will I face? Because I'm not able to do it. So they have this kind of condition. So yes, the guilt is also there. Because of the guilt, they don't turn up telling everything. And then when the next session comes, yes, they open up. Okay, ma'am, I was not able to do this, so I dropped it, and I'm gone back to my whatever regime I was following it. So these all things are there. We have to tackle many things. So that's the reason when I say that only one counseling doesn't work. We have to be there with them throughout. After 3 days, when I don't see any patient's track record, I just put a message, where are you? Because I'm not getting any message from you. So there's a time when you come to know, ma'am, I'm not able to, do all these things. So this is how, yes, guilt and shame condition is always there. But the first thing is fear of failure, what they have got.
As you said in between, you had a client with infertility. I would love you if you could share a transformative story of a client where the emotional health in their health transformation, and you could see a big transition from their past to the present life.
There are many, but then two, this were very interesting. One is about type 1 diabetes. When I was in Mumbai, Thane, practicing at that time, one girl, she was in eighth grade. And when she came to me, it was like diagnosed type 1 diabetes. And she was totally devastated, completely devastated. But over a period of time, she began to accept that insulin, she has to take insulin. Type 1 diabetes, they have to take insulin throughout their life. So she accepted that, yes, insulin is going to become her lifelong companion. Now, what struck me was every time when she used to come, she was so good in medical terms. Whatever terms we use as a practitioner, she used to tell us that my postprandial is this, or this is what I have taken injection, the name XYZ injection name she tells. And then she says, Ki, my postprandial is this. I just took this at this time and I have taken this. So that was a time when I told her, see how good you are in, remembering all these names. It's very difficult. People, they just say the color of the medicine, wo peela tha and neela tha. So she was very much into, and she was just in eighth grade. So I said ki you can go in this line field, so that you are in always connected with the medicine line also, and you will know about the researches or the updates happening in your field, medicine field, and try to go in this field, so that you are always connected with the medicine, and also you can earn, because it is not a easy thing to be on insulin throughout your life, because it's a expensive, costly affair. So, and then now I get the message from her that, yes, ma'am, I am trying for my these competitive exams to clear for a medical test, and or else if I am not clearing, I'll be going for this, which is connected with medical line. So that is where she's taking insulin, and she knows everything, because we had to be with their school people also, to connect with them that she has got this condition. So we went to the school, and we have given all the demo that she might be getting into this condition, hypoglycemia. So what has to be done? So everything has to be, it's like a family kind of thing when a type 1 diabetes is there with the person. Yes. So the next example will be some story. Yeah. So I'm connected with the food gym company, which is based at Bangalore. So one of the client who is from deep rural place, she was having this infertility issue since from last 13 years, 13, 14 years. And she has done all the treatments, and everything is she has mastered the treatments, all the treatments she has gone for. She came to me, and then it was for weight reduction, and just for weight reduction. It was just for weight reduction. So she got a translator with her as a relative, because she was Telugu. I don't know anything about Telugu, and the translator, she knew something. And she used to talk in English with me, and then she used to translate. But there are time, because I take every week session. There are time when translator was not there. So when I used to talk to her, it was a sign language, that you need to make a powder of this. So you need to add this, or this is. And then she used to, but then she religiously followed it. And I was given, it was like a challenge, 3 months, where it was like 13, 14 years she was not having the issue. It was just a 3 months. Every day I used to take her track things, and the team was there. And she followed everything religiously. At the end of the third month, 1 week was left, and she said that, "Ma'am, I got pregnant." And
Oh,
then it was a great news. But then in between, there was a lot of hinders. She was in a rural place. She cannot go, and she cannot go for walk, exercise, a social stigma. But you cannot go a certain, do certain things in a rural place. And the food habit also, she has to change a lot at home, because whatever we were suggesting, whatever food, they think that whatever they are eating at home, homemade food, is always right. But it is not. As I said, therapeutic nutrition changes.
mm,
When the conditions are there, you have to change many things. You need to add a lot of things which has got phytoestrogens and all those, which helps in balancing hormones. So she did everything, and then that was a result which I got in third month, that yes, she is pregnant, and now she might have delivered. So yeah, that is the two true stories which I can tell you.
that
Yeah.
was fabulous, Shobhana. 13 years of treatment. I can understand
Yeah.
what all that lady might have gone through, all the taunts, all the negative talks, all the self talk that she might have done for herself, all the negative talk she might heard from someone or the other. And apart from all that, she stood strong with your diet and she conceived. That was beautiful. You're a mentor to other professionals as well who are working with nutrition and wellness. What ideas or advice or suggestions would you give for them to integrate emotional intelligence also when interacting with their patients for their engagement?
Okay. So, yeah. So, there I could say the first thing what I can say is listen to them more than you speak. It's always better to, listen everything, all the aspect of your patient, and you need to give time. It's like first counseling, it goes like maybe for 45 minutes, 1 hour. You need to listen them everything, because it is related to health. It is not the thing that I have to write certain things, and just you just follow it and you'll get a result, because it's a natural process, natural things what you're going to eat. That is where you need, I would suggest, as a person in this field, that listen to them first. That is important. And empathy plays a very important role. You need to understand that yes, it is not you. You just think that a person is having certain problems, and that's why their behavioral changes is, you can see that. So that empathy has to be there while dealing with the people having certain problems. So empathy plays a great role. And then we can focus on the then comes the third stage, that yes, goal setting. As I said, that goal setting has to be made. It has to be collaborative. You need to ask them. Your goal setting, your mindset will not work on the person. So I know that blood sugar has to be reduced when a person is coming with diabetes, but that might not help him or her in the first go. You have to tell them that yes, eventually you will reduce. You have got that 400 now. The person has heard somewhere that weight, sorry, exercise karo and then blood sugar kam ho jayega. So if you are into this 400, 500 blood sugar, you cannot go on the first day. For there are ill effects also with that when you have got high blood sugar, and you should not do the exercise. So there is science behind it. So all these things has to be eventually set. The goal setting has to be there. But first is that yes, you need to listen to them. I would suggest that first is to be like that, and then empathize, and then set a goal, and then you can. It becomes very easy. And make make the things simple, because it's a medical term, and when you don't simplify them with things, whatever you are asking them to do, you need to simplify that. So that simplification is very important. So all these things should be taken care first. So that will be my.
I liked when you said active listening, because all the people, including me, as you know, I'm an emotional intelligence coach. We also say it is
Yes.
first listen. Listen to everything what the client has to say, because when active listening is done, I think 50% of the solution comes out by themselves itself, because the
True.
solution is also
Very true.
there with them. It is when they talk their heart out in a non-judgmental, in a safe environment, that you can really help them get over their problems. So
Yeah.
that was one thing. And the second, what you said was empathy, right? Without empathy, I don't think any wellness help can go far, because when you're counseling, when you're suggesting, if you're helping also, without empathy you cannot go far. Now for individuals, we know, Shobhana, how much reels and podcasts and YouTube videos are there available on what to do to reduce weight, what to do if you have diabetes. There are so many reels and advices and suggestions going around. In this scenario, when an individual has to seek a perfect nutritionist for their for their well-being, or to change their lifestyle diseases and to better their well-being, how do they know whom to approach, and this is the right person to go to?
So, yes, credentials. Now, here comes the credentials, which is very important to understand that yes, I should approach the person who is well versed in this, who has done some research work and connected with the authentic people, who are connected with the authentic hospital or authentic people. And the credentials also, yes, plays a very important role. Then comes how the person is giving you the advice. So to have that authenticity, definitely credentials has to be taken care, because nowadays it's like, as you said, a lot of people coming over, giving that lot of information. People are consuming a lot of information from different people. In our family, in our condition also, people, they come to me and they say, Aj, I have seen all these things in the reel. Is it true? So they are asking me at least, is it true? But then the person who is not able to connect with anyone, they will start trying doing all those things. So you need to connect. This is a science, whether it is a diet, whether it's a medicine, it's a evidence based thing. A lot of research work has been done over it. You cannot guide anyone just by saying that this helped me, so this will help you. Maybe after drinking a lot of water, a person might be in a normal condition. But the same thing, if you give advice to other, that after having all those water, the person might land up into a lot of gut issues and gut health. So this cannot be same for everyone. For that, you need to reach the right person, the authentic person who is connected with the authentic place. So you can check the credential first, and then there are quacks, a lot of very easily they just go get into. This is a science of 5 years and so many years behind this work, and people they get into like very small and shortcut things, and they'll end up into telling a lot of wrong information, giving wrong information. So it's better to check the credential and see that the person is connected with a right place or authentic place. So yes, it has to be like that. Yeah,
Shobhana, that means one size doesn't fit all, and everyone has to be aware
correct.
what fits them and what doesn't fit them. Some remedy might
Correct.
work for someone, but some might not work with the other person the same way. For the same issue also and the same condition as well.
Yes,
Right?
yes, yes, yes. Definitely.
What advice or suggestions would you have for future people coming into this field of counseling and into nutrition?
So it's a very interesting question. Now, I'm not a person to give that much of advice to those people, but yes, throughout this journey, 30 years of experience, I could say the person who is into this field, it's not just for, a kind of, you are, yeah, you might be passionate about it, that's okay. But then you need to be updated first. You have to be into that because science, it can change every day. Maybe there might be some evidences which is working at present and which will not work. So you need to be updated with the subject. You need to read a lot. You need to be with the subject, and then you make yourself in such a way that the counseling is the first thing. When wherever the nutritionist or dietitian, even the doctors, everyone, counseling comes the first. If you can counsel the person according to their likes, and you can set the goal, as I said, it becomes half done. So the counseling helps you a lot, and your word should be a motivation for the person to get up next day and do all those things what madam has said or sir has said, yeah, given the advice, whatever it is. So that has to be there. You need to be well versed with the subject. You need to understand the day to day changes what has come. You need to understand the atmospheric changes what has come. You cannot say that the present the one when we were child, so we were having uh, a lot of things which were good, now it is not happening. No, you cannot say that. You have to bring that point that both the things are working. If a person is if a child is saying, okay, I want to have noodles, you can give the options. Now you have got a lot of options available. It's just an example I'm telling you. So there might be some good options. For example, you might be having this millet. We are working responsible wellness team, which are we are working with the millet conditions, millet products also. So this millets can be like millet noodle. If it is healthier than that plain noodles, that can be a substitute. So you need to know how to balance that old things, and don't think that our old regime or the that rigidity should not be there. You should be flexible to mix everything, and you should tell what is right. So yes, counseling plays a very important role. You should be very good in your communication, so that it is very clear to the person who is seeking advice from you. As I said, you need to simplify things. It's a medical term. You cannot, put all those things on the person. You just simplify, and it happens, Geeta, that my patients, wherever they are in this world, they know how to tackle their diabetes. They know that after every 3 months, they have to do this test. In a year, they have to go for cardiac checkup, eye checkup, all these things, because they know the complications of that. So this is where you just go on giving them small doses of your knowledge, your counseling, and then everything is normal. And because we are having the number of diabetes in our country, it's on a higher side. So it's because that we are on a higher, the population is on a higher side, so that number comes on a higher side. So we are the highest diabetic people in the world. But then it can be managed. Diabetes can, I tell you, diabetic people are much more better than general public, because they get disciplined. If they are counseled properly, if they get all that counseling properly, they get disciplined and they live much better life, because they come into that discipline, and they can live, yeah, so longer life.
So as
Yes.
you said, change is the only constant. So we have to embrace that change rather than being rigid about this is how my grandfather did or my father did. Now I am going to do this. No, please. The world has changed a lot. Please change yourself. The
You have to,
mindset needs to
yes,
change. You have to get that mindset to embrace the changes coming in and move forward.
true,
So
true.
that was a beautiful conversation with Shobhana Nair, and the information and the knowledge you shared. I cannot say how much it could be of help to someone out there listening. So anyone who wants to connect with Shobhana, all the details for her will be in the description box. And now, if you feel stronger with clarity, inspired to work on your mindset,
Yeah.
or ready to elevate your wellness journey, message me responsibility, because responsibility is yours. It is your health. To unlock an exclusive pathway to my high tier emotional intelligence coaching, let's craft your breakthrough together. Also, all I want to inform you, there is a wellness retreat coming up in around Kochi in January. If you are interested, please message me in the DM. Thank you. Thank you, Shobhana, for being here and sharing the valuable knowledge that you had.